All right. Thank you so much for that introduction. A real quick update on my bio. So yes, I was the Associate Director of Regional Research at the Houston Education Research Consortium. Since then, I've had the privilege to be the Senior Director of Research at the Kinder Institute, where I helped to launch 4 research centers focused on housing and neighborhood, community and public health, economic mobility, and population studies. Since then, I've been very fortunate and lucky to be able to hand off those responsibilities, including to Dr. Luz Garcini here in the audience, who is our Director of Community and Public Health now. And since being able to hand off those responsibilities, I am now the Director of the Houston Population Research Center at the Kinder Institute, where we house our survey work. And so I will be speaking with you all today about our survey work and how we have used it to learn about the community health trends of residents here in the Houston area. So folks here might be a little bit familiar with the Kinder Institute and some of our survey work. We are probably most well known for our Kinder Houston Area Survey. This is a survey that has been done on the Houston area since 1982. It is the longest running survey of any major metropolitan area in the entire country. While this is our legacy, we are in the process of building on that legacy and unpacking new trajectories for what we want to do and how we want to go about learning about the Houston area. In particular, we've started a new chapter with our survey work. This began back in the fall of 2021. Previously, with our Kinder Houston Area Survey, we relied on longitudinal cross-sectional studies where we were every single year reaching out to the Houston area residents, asking them a set of questions. Beginning in the fall of 2021, we began to recruit a cohort of adults in the Houston area, specifically Houston and Harris County, where we were going to follow them over time. This was a very costly undertaking, but ultimately produced a panel that is allowing for us to conduct quarterly surveys that we are building in collaboration with community organizations to make sure that this information is getting back into the hands of decision makers and policymakers. And we are offering insights into the ongoing experience, conditions, challenges of specific neighborhoods, as well as the residents in Houston and Harris County, and how those things are changing over time. And so from 2021 to 2023, we built the Greater Houston Community Panel, GHCP for short. The recruitment proceeded in 3 different stages. Again, in fall 2021, we started this recruitment. We brought in about 3,000 residents at that time. In 2023, early 2023, we built on that, adding an additional 3,000 residents, and then we finished out our initial recruitment efforts in spring 2023 with an additional 2,100 residents. While this does add up to over 8,000 residents, as we will see, some of them have not been so keen to follow up with us, and so we're not necessarily hearing from all of them all of the time, but this still leaves us with an incredible tool with which we can use to explore the Houston and Harris County area. For building the sample, we used an address-based sampling approach where we worked within 30 PUMAs to draw samples of residents based off of addresses. We oversampled on Hispanic residents just to make sure that we were capturing that group well enough here in the Houston area. In terms of how we went about doing this recruitment, we went old school, sending out mailers, postcards, and then we got a little bit of new school by sending out some text messages. However we could get a hold of people, we were interested in trying to get a hold of folks, inviting them to participate in the panel. Currently, our panel has about 7,000 active members in it. We have administered quarterly surveys every single quarter since winter of 2023. Our quarterly progresses with winter, spring, summer, and fall. As I was giving a practice talk, someone said, "Great job, James Taylor." I very much appreciate that. Not intentional, but nonetheless, that is our sequencing. We do offer our surveys in Spanish as well as English. They are administered online. Again, while we recruited people utilizing mailers largely, as well as some text messages, ultimately we were driving people to participate and respond to an online survey. One of the ways in which we have kept people around is that we do provide incentives to our respondents for every single survey they complete. That incentive amount is $15. Most of the surveys that we field will get somewhere north of 5,000 respondents. When we weight this sample, it makes it representative of Harris County's demographics. Additionally, because of the way in which the sample was drawn, we were able to develop 30 neighborhood areas that are sub-geographies located within Harris County so that we don't just have the opportunity to report on the overall trends in the city and county, but rather this gives us an opportunity to talk about and show trends that are taking place within the county at those smaller geographies. In doing quarterly surveys, we have had the wonderful opportunity to talk with these residents, talk with these individuals about a variety of topics. These have ranged from things like social connectedness, fear and experiences of crime, parks and green space, both in terms of their access as well as the quality of those, civic engagement and participation, as well as the health of democracy. That report coming out later this summer. Disaster preparedness, something that's probably on the forefront of a lot of people's thinking, as well as things like collective efficacy, understanding the upcoming energy transition and what that means for Houston, artificial intelligence and how that has implications for the work that residents are doing, as well as climate change and the reality that that brings to the Houston area. All of these things are being collected along with an array of socio-demographic information that provides us with a quite frankly, unparalleled examination of a major city here in the US. In addition to these topics, we have fielded 2 health surveys. Our first health survey went out in the spring of 2023. This was the first survey that went out after our second stage of recruitment, and so as you can see, we had about 4,200 respondents to that survey. Our most recent health survey went out in the spring of 2024, to which we had over 5,200 respondents. The topics that we have collected information on when it comes to health can vary from things such as just general self-reported health ratings, chronic health conditions that people have been diagnosed with, presence of health insurance, as well as their ability to access health care, as well as self-administered indices such as the Kessler-6, the PHQ-4, well-being index. And we've also looked at things that are related to the social determinants of health, be they sleep quality, food insecurity, as well as employment and financial circumstances and conditions. All of this is information that's collected through these different surveys, and we are in the process of working on releasing reports from these surveys, as well as working to get these data released for researchers around the country to be able to use these to further understand patterns and trends here in the Houston area. With that being said, I'd like to share with you some of what we are learning, some select findings, specifically looking at the spring 2024 health survey. First finding we can talk through, 1 in 5 Houston area residents is rating their physical health as poor or fair. And when asked how many days of not good physical health had they experienced in the past month, on average, respondents were saying 4. Turning our attention to mental health and its importance in the lives of our Houston area residents, 1 in 5 Houston area residents reported their mental health as either poor or fair. And when asked how many days of not good mental health had you experienced in the last month, the average amount was above 5 days. Looking at chronic health conditions with which residents had been diagnosed, you see 1 in 4 of our respondents saying that they had been diagnosed with hypertension, some sort of high blood pressure challenge. 1 in 5 reporting that they were diagnosed with high cholesterol. 1 in 6 having been diagnosed with some sort of a mental health condition, such as depression or anxiety. And when we look across all of these different diagnoses, we arrive at the conclusion that fewer than 4 in 10 of our residents are reporting no chronic health conditions. Turning our attention to some of the scales that we had administered for purposes of self-reported mental health, we collected information on respondents' depressiveness and anxiety using the PHQ-4. In addition, we asked people about their substance use. When looking at the PHQ-4's total score, about half of residents reported no symptoms, 28%, or about 3 in 10, reported mild symptoms, and 19%, or 1 in 5, were reporting moderate to severe depressiveness and anxiety symptoms. These are obviously not clinical diagnoses, but again, giving us an idea about some of the mental health challenges and the mental health crisis that is currently going on in our society, specifically here, including specifically here in our Houston community. When turning our attention to look at the question of substance use, about 1 in 12 Houston area residents reported using some sort of an illegal drug or using prescription medication for a non-prescription purpose. Turning to the question of healthcare access, about 1 in 5 Houston area residents is without health insurance. Now, it is important to point out that this does vary significantly across race, ethnicity, as well as age. In particular, when you look at race, ethnicity, for the most part, Asian, Black, white residents, they're reporting about 1 in 10 without health insurance, or even fewer than 1 in 10 without health insurance. When turning your attention to look at Hispanic residents, that's 1 in 3. 1 in 3 Hispanic residents reporting that they do not have health insurance. Looking at this by age, and perhaps these are not necessarily surprising trends, but they are a reminder of the challenges our community faces. Young adults, again, about 1 in 3 18 to 29-year-olds is without health insurance, and that does tick down quite significantly as you get older. As our residents get older. In addition to this challenge we are faced with when it comes to being uninsured, we also asked residents if they had felt like they needed some sort of medical care in the past year, but for whatever reason, for some reason, they had been unable to go get that. We heard from 1 in 3 residents that yes, in the past year, they needed medical care, but they had delayed or not gotten it for some reason. The different barriers to that can range from things like simply cost, lack of knowledge about where that care can be provided, the perception that they can take care of the matter on their own, and a variety of other things. Again, all of these representing barriers that are preventing our community from getting the care that it is needing. Turning our attention now to some select non-medical drivers of health, thinking about housing and the importance that plays for our health and well-being. Nearly half, 5 in 10 residents reported that they were worried that they would be unable to pay for their housing within the last year. That's 47% specifically. More than 1 in 5 residents had experienced very low food security in the past year. We see another 1 in 5 residents having experienced low food security in the past year. Total of 40% reporting some sort of food insecurity. Considering additional non-medical drivers of health, thinking about social connectedness, the importance that knowing and belonging to something and knowing one another and belonging to something plays in our lives and our well-being. For more than 4 in 10 residents reported belonging to 0, in other words, no social, cultural, or political groups. Again, that specific percentage, 45%. We are a disconnected society. More than 1 in 5 residents get 0 days of either moderate or vigorous physical activity. 21% of our residents reporting no exercise in a typical week. We can explore some of the consequences of that by looking at how people rated their physical fitness. And again, this gives us an opportunity to see the way in which our subgeographies work here within the Greater Houston Community Panel. About half of residents in 7 of 30 neighborhoods, those 7 of 30 neighborhoods are the ones that are in dark red, maroon, some might say. About half of residents in 7 of 30 neighborhoods rated their physical fitness as poor or fair. The lighter yellow color, this was less than 1/3 of residents who reported their physical fitness as poor or fair. So even our good neighborhoods were still reporting roughly 1/3 saying that their physical fitness was poor or fair. Again, speaking to some of the challenges with health, physical activity, fitness here in the Houston area. So what's next for the Greater Houston Community Panel? Well, first, I think that what we've demonstrated with this tool, with the GHCP, is that surveys can be used to help us understand the lived experiences, the conditions, as well as the health of residents. This is not necessarily always something that we agree on in terms of the findings or the implications of this type of research, but nonetheless, the evidence that we are collecting is continuing to build a body of work suggesting that the surveys are a tool we can use to gather those insights. We are interested in continuing to diversify the topics that are included in the Greater Houston Community Panel. The list provided earlier does suggest there is already quite a degree of diversification taking place. Well, we can continue to build on that, especially given the quarterly administration of surveys. There is ample opportunity for us to be connecting with this panel, learning from this panel, hearing from this panel, and sharing about what we are learning and hearing out into the public and to the decision makers. And to that point, it is critically important that we connect this information, and I should say maybe continue to connect this information with local, state, and national leaders, decision makers, policy makers, those folks who can use this information to either drive interventions, to drive new policies and practices, pass new legislation, whatever it might be, in order to assist in improving the outcomes of residents, both here in Houston and beyond. And then finally, we are interested in growing this beyond just Houston and Harris County, so that when we talk about the Greater Houston Community Panel, we are indeed talking about residents that are part of the Greater Houston area. Our two next destinations are Fort Bend and Montgomery County. When we expand the Greater Houston Community Panel into Fort Bend and Montgomery County, we will be talking to residents that are representative of 1 in 5 of every Texan in the state, 1 in 5. So we will be providing a platform, we will be producing a megaphone with which information can be used to go to Austin and beyond to make sure that we are making our point heard, and bringing resources into this area to, again, address the needs and wants of our residents. There is other research that is produced by the Kinder Institute beyond just the Greater Houston Community Panel. All of our research is free and available to the public. I direct you to the website kinder.rice.edu. And I thank you for this opportunity to present about our research.